There are quite a few myths around becoming an implant dentist, and I think some of these myths actually stop dentists from getting started. Over the years, I've heard things like you need years of experience before placing your first implant, or implant placement is the hardest part, or you need a huge amount of expensive equipment before you can even begin. I'd like to share my views on some of these common myths based on my own experience, and hopefully I can help you along that. And I'll tell you what I've learned along the way. Hopefully this will give dentists who are thinking about getting into implant dentistry a little bit more clarity and confidence. So let's start. Myth number 1, you need years of experience before placing an implant. Now, proper education, careful case planning and case selection, and mentorship matter far more than years of experience. Plenty of dentists have 20 years or more of experience doing restorative and have never placed an implant, while others place their first implant within a few years of graduating and go on confidently. Time alone does not build surgical skill. Structured practice does. Myth number 2, implant placement is the hardest part. Reality. Placement is usually the most predictable part of the entire process. The difficult work is diagnosis and planning, deciding whether the case is suitable, reading the scan properly, and positioning the implant for the restoration that has to follow. Get those right and the surgery itself becomes execution rather than problem solving. So it's not really hard. Myth number 3, you need expensive equipment before starting. Reality, you need a surgical motor with irrigation, the drill kit for your chosen implant, a torque wrench, and good suture material that'll cover your early cases. Everything beyond that is refinement you can add as your case volume justifies it. Do not let a wish list of equipment become the reason you never start. You will also find lots of implant companies are happy to lend you loaner kits for doing your first implant. Myth number 4, every implant requires grafting. Reality, many straightforward cases have adequate bone and need no grafting at all. This is exactly why case selection matters. Choosing sites with good volume of bone for your first cases lets you build surgical confidence before adding the complexity of regenerative procedures. Grafting is a skill you grow into, not a prerequisite for starting, but the understanding is important. So choosing the right cases is the way to go. Myth number 5, surgical guides are only for experts. The opposite is true. Guides are most valuable precisely when your freehand judgment is least developed. They let you make angulation and depth decisions calmly in advance rather than under pressure with the patient in the chair. Many experienced surgeons place freehand because they have done thousands of cases and beginners have not. Myth 6, you should start with complex cases. Really, nobody should. Confidence is built by accumulating successful, predictable outcomes, and complex cases attempted early produce complications that can set a clinician backwards or stop them altogether. Begin with simple single implants in favorable size and let complexity arrive gradually as your judgment catches up with your ambition. So refer those cases that are harder initially and then choose your cases wisely so you are successful in your outcome. Myth 7, patients are afraid of implants. Reality, most patients are afraid of the unknown, not of the implant itself. When the process is explained clearly, what happens, how long it takes, what it will feel like, and what the alternatives are, most patients respond well to a predictable long-term tooth replacement option, in my experience. The fear more often sits with the clinician actually than the patient. Sometimes implants are easier than extractions or even fillings, and they can be quicker depending on your skill set. Myth 8, one course makes you an expert. A course gives you a foundation, a workflow, and a starting point. Mastery comes from repetition, reflection, and having someone experienced to discuss cases with as they become harder. Any course promising expertise in a single day is selling something. The honest promise is that you will leave knowing exactly what your first case should look like. And then, of course, there's further options to help you get better. So Those were some of the common myths I hear about implant dentistry for me. The biggest message is that you don't need to know everything before you start. What you do need to know or need is the right education, good case selection, careful planning, and importantly, the right mentorship and support around you. Implant dentistry is a journey. Start with simple, predictable cases. Build your skills step by step, and your confidence will grow with experience. Don't let these myths stop you from taking that first step. I'd love to hear from you. What's the biggest thing holding you back from placing your first implant?